Welcome to the Quality Measurement in Health Professional Education, Revisiting the Metrics, our international conference, which I'm very pleased that kicks off today with the pre-conference workshops. Assessing the quality of health professional education interventions is a task that appears more difficult than the comparable task with clinical intervention. What to measure, how best we can measure it, and so what are important questions we are struggling and trying to find answer to it. Aim of this conference is to create an opportunity for health professionals, educators, regulatory bodies, healthcare authorities, public and private healthcare services providers to interact with experts in the fields of quality and assessment, share experiences, and how to introduce new assessment methods in their own contexts. The speakers are scholars and leaders of innovations in health professional education. The conference will be an excellent opportunity to meet, discuss, and exchange opinions and best practices in the field of assessment and program evaluation. It gives me a great pleasure and honor to present Professor Judy McKimm, the Emeritus Professor of Medical Education, Swansea University Medical Schools, Wales, UK, and Professor Paul Kinnes-Jones, the Associate Professor and Program Director, Graduate Entry Medicine Program at Swansea University. I'm very pleased that they will share with you, through this interactive workshop, a very interesting topic on making the subjective objective, assessing leadership and interprofessional team working. Two difficult domains, leadership and interprofessional team working, which are now integral to all the competency frameworks in all health professional education programs. We still are struggling how to define these competencies and how to assess them. And I'm sure Judy and Paul will throw light on how to assess these competencies. Thank you very much, Judy, and thank you very much, Paul, for accepting our invitation and being with us today, and we'll be very keen to listen to your presentation tomorrow. Thank you very much.
Are we okay to start then? Excellent. Hopefully I'm loud enough. Just tell me if I need to shout more. And the session is being recorded, isn't it? So that's good. Hi everybody, I'm Judy McKimm, as Prof Hamdi said. I'm Emeritus Professor of Medical Education at Swansea, but also help teach on the Masters in Health Professions at GMU as well with Paul. So today, Paul and I are looking at really at thinking about how we surface some of the subjective elements that seem really hard to assess in terms of team working and leadership, and how do we do that? What can we do? Where are the challenges and what we can't? So if I just start, Paul, if that's okay, because I've done a Menti for this. So making the subjective objective. We're going to have a look at the two linked elements of leadership and interprofessional team working, and we'll explain how we do that. So what we're going to have a look today is this workshop will be interactive. There will be some little bits of talking from us, but a lot more from you. So really thinking about, let's give ourselves a forum to discuss elements of professional behaviours and how they can be assessed. And for these professional behaviours, we're specifically looking at leadership and interprofessional team working in both the clinical and the academic context. So no matter, you know, what your role is, you can hopefully get something out of this and also contribute. And what we aim to do by the end of the workshop then is that you will be able to identify more opportunities for implementing and assessing practice and behaviours in your own educational context. So a place to have some discussions, a place to ask questions, and I can tell you now we don't have all the answers, but we might have a few. So the first thing we'll do is let's find out about, you know, who you are and why you're attending the workshop. So I've set a Menti up. Just let me escape out of here. I need to, oops, sorry. Let's leave that up like that. I just need to make sure it's on present. Right, okay. So that should be set up now. And in the chat, I will put also, there's a link in the chat, so you can click on this link. You can use the QR code on your mobile, which I think is probably the easiest. And what it will make is some sort of word cloud that I will see as you start to join. Okay, so Mentimeter, if you haven't used it, it's really useful. It's quite quick, and it can be free, and it's quite nice to get people interacting. So just put a few words or short phrase about why you're attending this workshop. If you want also to put your role in there, you can, like program director or clinician or whatever. Is that live, Paul? Nobody's coming on it just yet.
Check.
Oh yes, one's joined. Yes.
Yes.
Right. Excellent, people are coming in now. So, and when you've got it open, don't close it afterwards, because I've got another one a bit later on for you as well. Okay, so just give you a few minutes to do that. So can we see the word cloud? Yes, Paul?
Yes.
Okay, do you want to just talk that through while I answer the door?
Excellent. So, as you can see, the whole point of word cloud is that it will basically put all the words you put into it, but it will increase the size of them depending on how many times people mention it. And we can see understanding leadership, assessment leadership, ensure safe assessment. Your background seem to be from university, you've got grader, educationalist, got middle managers, you've got program lead. And then the sorts of things that you're thinking about in terms of assessment is simulation-based assessment, assessment of subjective, which we've just put in, leadership assessment to understand how can you assess leadership? It's always very difficult to think about that. You've got new leader role. So some of you might be in a new leader role, and I think very often we go into leadership roles a little bit unprepared in terms of how do you lead a team? How do you kind of make sure that people know what your vision is and you cascade that out? So excellent. So that's a good start in terms of what we're here for. Lots on teamwork. Teamwork is important. Why should we assess? And I think more importantly is how should we assess? So excellent.
Okay, stop sharing that. I'm just doing some interviews at the moment on a project which I'll be talking about tomorrow in the presentation. And she just said to me, should we not, the hard bit isn't the what, it's the how. How do we measure? How do people do things? And I think that's our big challenge, isn't it, really? So Paul, do you want to go, or do you want me to? I don't mind.
Got it.
Okay. So what we're going to do now is just set the scene about how what we're talking about fits with the professional behaviours. I've done that. I've done the aims. You're on professional behaviours now.
So the first thing we need to think about is our professional behaviours, and when we break those down, we can look at certain personal qualities. Obviously, what we need to think about is honesty and integrity. We all know that we need to be honest, and I think we have found over the years that being transparent, which is the same sort of thing as honesty, with students and faculty, is a lot easier. It's a lot better if you're open in the front. In terms of personal qualities, particularly for students, but are obviously relevant for faculty as well, punctuality, timekeeping, and attendance. And I think, particularly now with COVID, attendance has always been very difficult to monitor. And I think we've all had situations where we've run a session on Zoom or on Teams, and somebody hasn't put their photograph up, or they've got their video off, and you don't know whether they're there or not. So you ask a question and you get very little feedback. So attendance has become a little bit more difficult to manage recently. It's easy if somebody is in a lecture theatre and they appear to be concentrating. It's difficult if they're on Zoom and the video is off. Having the element of respect, your dress code. We all have, and it's difficult, I think, particularly for healthcare professional students, when they come into a university setting, they might be very casually dressed, but they are entering a profession. And therefore, when you've got that, you need to think about how they dress ready for clinical practice. Reliability, insightfulness. So having insight, very often we might have students who don't have insight into their weaknesses. And we will talk a little bit later about reflection. Recognizing your own boundaries. So knowing what your own strengths are, knowing more importantly, what your own weaknesses are. And if you're in a team, bring in somebody into that team to make up for your weakness. And then the personal quality of how you handle emotion. And I think that is very important, particularly now with the stresses and strains that COVID has given us, but working in large organizations. The other aspect of professional behaviors is working with colleagues. So that element of team working, making sure you maintain your professional boundaries, understanding the impact of your behaviors on others. And very often, and it's why we often look at, say, 360 appraisal, is how do other people perceive us? We might think we're behaving okay, but we need to make sure that we understand that our behaviors will impact on others. And that idea that what Judy calls the dance of leadership is thinking about leadership and followership, when we need to step up and take a lead, but also very important when we need to take a step back and follow. And we all lead and we all follow at different times in the context of our professional life. So let's start with some basic definitions of team working. We know it's a work-based practice carried out by two or more individuals who cooperate on a permanent or a temporary basis, remember it might be project work, to achieve shared goals. That we know that effective healthcare teams should enable each individual to make a distinctive contribution based on mutual respect and their professional role. And that makes, when we're thinking about identity in a team, for individuals to have a distinct contribution to make sure they feel valued, that they feel part of that team. But we know that health professions generally and typically work in quite a large number of teams, whether it's uniprofessional, whether you work in a nursing or midwifery or medical team, but also those multi-professional teams where you have multidisciplinary teams to consider things like palliative care, or even mental health teams where you have primary care, perhaps linking with secondary care and working with all those professionals. And we know that learners need support in working in those multidisciplinary teams, particularly if they move in locations all the time. We tend to think of students moving from one place to another. We know that when we're working clinically, we can make those changes because we're familiar with them, but students are very unfamiliar. And therefore you have to learn how they can integrate into all the different teams that they're going to be involved with. So let's think of some of the benefits. We know that there are benefits, so we know that effective collaboration and interaction can have direct ramifications for patient care. And many reports have indicated the need for that move towards more collaborative teamwork. Lubovnica and West talk about the benefits of team-based working in healthcare, as in reducing hospitalization and reducing the costs, looking at higher patient satisfaction, thinking about increased effectiveness and innovation because you've got different people from different disciplines. They're all offering different perspectives. That multidisciplinary teams deliver high quality patient care and implement more innovations because they're looking at it from different angles. And it's only by pooling those ideas and innovations that you can start to think about improving patient care. This ultimately leads to lower patient mortality, reduced error rates. Again, if you have all the different disciplines looking at the same situation, they will find the best way to get through it. And therefore, because you created that team-based working approach, you have reduced turnover and your sickness absence is lower because people feel happier when they're at work, they feel comfortable, they feel safe, and that's all part of working in a team, is having that element of safety and being happy in your work, so you're less likely to one, want to leave, and two, less likely to go off sick. Now, when we think about collaboration, to define collaboration as an interprofessional process of communication and decision-making that enables the separate and shared knowledge and skills of healthcare providers to synergistically influence the ways client or patient care and broader community health services are provided. So we'd start to think about pulling all those elements together in terms of thinking that you need to collaborate. So what are the aims of teaching professionalism? Can you teach professionalism? We know that you need to think about enabling students to understand the origins of professionalism and the proper sets of responsibilities of that particular profession. We need to think about instilling and nurturing in the students the development of personal qualities, the values and attitudes, and the behaviours fundamental to the healthcare practice. And obviously, finally, the most important is to ensure that students understand the importance and relevance of the ideas, the concepts, that they can demonstrate these qualities in their work, and then are willing to continue to develop their professional identity. So did you want to say something, Professor McKimm?
I was going to pick up the next slides if you like.
Okay, no, go on.
So you can keep it up though.
Yeah.
So one of the things that professionalism itself, and obviously that includes this team working and collaboration elements of it, we know that early indicators of this can predict later concerns, and Papadakis' study really showed that, that these early flags where we have a little query about people can be there. So one of the things we have to think about is when we're selecting our students, are we selecting people who can be collaborative, who can actually work in teams and respect other people and things like that? How can we do that? So that's one of our key indicators, really. We're helping people develop into proto-professionals, what Sean Hilton calls the proto-professional, but develop this practical wisdom throughout all our education and training. And so selection is our first assessment. And how do we look for those qualities? That's one of our first challenges, really. How do we also identify people who aren't very collaborative and who aren't team players? Because, as Paul says, that's a risk, isn't it, to say patient safety. And so what we're also nurturing is this development of professional identity is really important as well. Next slide, please, Paul. So whenever we're assessing or teaching professional behaviours and professional values, we can't divorce it from the clinical context or the academic context. And we might expect different things from things like dress in the university as opposed to what people wear in clinical. You know, we might see differences there. But actually, when we're in the clinical context, what we're looking for in our students or our learners is these meta skills, some situational awareness. What's going on with the team? Is communication good? What's the contextual judgment? Do I need to step back here? Am I in the way? What have I got to bring to the party? So all these, what we call non-technical skills, communication, leadership, empathy, respect, are really important. But of course, we're assessing those alongside technical and procedural skills as well. So we might have a team in the operating theatre, and it's how the learner works with that team, or it might be in the anaesthetic room. So Nazar was asking the questions, is there any tool that helps us to select students? Yes, I think that's another workshop that we might do, but things like situational judgment tests, group, observing people, how they work in groups and teams, gathering evidence of how they've contributed to team working, asking them how, you know, what sort of things they bring to a team, trying to look at respect for others and inclusion are the sort of things we might look at there. So,
and one of the works, as Judy mentioned, Papadakis, is looking at how students are when they first join that program, and you've asked them to bring along photographs and certificates, and they turn up on that very first day and they haven't got the certificate, they haven't paid their fees, they haven't got the photograph. That work basically indicates that later on the questions, those are the students who are far more likely to attract our attention when it comes to being unprofessional. So it might be a little bit late once you've got the students and they don't bring their photographs on the first day, but it does give you then how you can concentrate your resources on working with those students and actually being open and transparent and saying, you know, 30 of you out of a group of 100 haven't bought in, and there is good evidence to suggest that you 30 probably will continue those trends going forward. So you can work with them to make sure that you can stop those trends happening later on in the profession.
Sorry, I muted myself. Yeah, absolutely. So what we're trying to look at when we're developing this very, Emad's asking if there are any scales for grading. Yes, there are some professionalism scales. When I finish talking, I'll put some in the chat for you, a couple of scales. But yes, there are. There's a couple of scales for measuring professionalism of students. So what we're trying to do is develop this professional identity, develop self-insight, get people to look at their personal qualities, their personality traits, so they know their strengths and their weaknesses, thinking about their values. How do they demonstrate their values? Can they modify the behavior if things are difficult? How do they respond to pressure? How do they work with others? Building in good supervision, good mentoring and support and feedback. And of course, role models are really important. They're part of the hidden curriculum. And so we need good role models who model good teamwork and behavior, or good leadership, or good followership, so that we can actually encourage our students to build these in. So really important for us in medical and health professions is that we ensure that our students, our graduates, our practitioners are safe to practice and they're fit to practice. So we're looking at the knowledge, the skills, the capabilities, the attributes, and we're looking for competence. We're looking for ethical and legal safety, and we're looking how they practice for their stage of learning or career. You don't expect the same from a first year student as you do from a new attending or a new consultant, but in terms of things like willingness to collaborate, being punctual, yes, we do. We expect those things right from the get-go because we've got professional, you know, this is a sign of being professional. And we also have to consider people's health through practice as well, their physical, mental health, or any learning disabilities. And we put things in place for people to reasonable adjustments so they can practice. So these shouldn't deter people from practicing or stop people practicing unless they get too severe. So for us, for fitness to practice, we're looking at the knowledge, skills and capabilities and the behaviours, and we're looking at, are they physically capable? And of course, with COVID, a lot of the things that we've looked at now, we're much more attentive to people's well-being and all that sort of thing now, because people have been struggling a lot. So when we're thinking, when we're thinking about teaching and assessing professionalism, we have to identify first. We're going to talk more about assessment today because that's the purpose of the conference. But actually, you can't assess until you find your knowledge, your skills, your behaviour, your attitudes. We need to define those first. We need to think about academic learning as well as workplace, and of course, the workplace is the most authentic and the real place where people demonstrate their professional behaviours. We're looking at how to provide opportunities for personal development for self-insight. Do we do that? Do we have reflective conversations with our students, or do we just teach them stuff and expect them, you know, to behave in a certain way? We have at the background professional standards and guidance from all of our regulatory bodies and our professional bodies, but be that the Commission or be that for us the General Medical Council. And then what's the theoretical base? What theories or concepts are helpful when we're trying to understand interprofessional team working? So what's the evidence we give people? Do we give them any models of team working so they can, oh yeah, I could work in this model? Do I understand group dynamics? So when we're thinking about the formal curriculum, these are just some examples of things that we might put in, and we might use these to work. So we've got things like the ethical and the duties. So we've got the standard there and the law, the regulatory body, and then all the communications. So communication skills or communication competencies really are at the root of leadership, followership, team working for the professionals. And so we can often teach something on communication, but actually what we're doing is enabling people to work in a team or to collaborate. And we can measure that if we want to as well. We can assess it. We need to teach people to take some self-care and care for those around them, cultural awareness, cultural competence, cultural intelligence. Reflective practice is so important because this process of being and becoming a professional and a good team worker and a good leader and a good follower are really important. You need to reflect, you need to get feedback. And a couple of the things that we do teach to help people sort of think about change are patient safety and quality improvement. How can we improve care? What might we do as a result of our reflection, our learning, etc.? And then, of course, we can teach some formal things around leadership as well. So we are going to just put you into breakout rooms for a short while, just to think of some of the challenges. Now, first, we're going to start with team working, and then we're going to look at leadership more specifically. So let's think about interprofessional team working at the moment. I have set 25 rooms. I could make a few more. We're not going to do much feedback. We're not going to do feedback from every room. Can I do more? Yes, I can do 30 rooms. 30 rooms, that'll be about right, will it, Paul? For 160 people?
160, yeah.
Yeah, so I'm just going to put you in these rooms and look at the time. I'm going to put you in for 12 minutes. And what I'd like you to do is, in those 12 minutes, just quickly introduce yourselves to others. We haven't time to go around 164 people or 158, I've just lost some. But I'm going to put you in the breakout rooms now. And then you can just have a little conversation with a few people. You'll have a little bit of networking. Just come out with a couple of challenges and be prepared just to post those in the chat when we get back. So in the chat, we'll get a big ream of challenges, and we will quickly just, when we come back, just have a look at those and review those. And then we're going to look on about how we might assess team working. Then we'll go on to leadership. So
Emad has asked in the chat about, do you recommend a structured course for teaching professionalism? And if you look at the formal curriculum component slide just before this, that does give you some ideas of perhaps what you could teach more formally. But professionalism does need to be throughout the program. It shouldn't just be a course you do and you pass it in your professionalism. You need to be looking at it throughout the whole of your program. But there are certain elements that, yes, would be useful to include as part of your curriculum, as part of your course, running through the threads of all the years of your program.
I think, yes, absolutely. I think what we've noticed recently, the General Medical Council, in their new guidance, actually professional behaviours and attributes are the first domain of professional practice. They were always the last. It was knowledge, skills, professionalism, and now it's professionalism is first, recognising how important that is. And this is why we're focusing on assessment of this today, because it is just so important. So I'm going to open the rooms. You've got 12 minutes. Unmute yourselves as you're going. Get talking, because you haven't got long. Come out and just a couple of one or two challenges that you're prepared to put in the chat when you get back. Okay, with such a lot of people, we're going to work swiftly, but I think we can still do a little bit of interactivity. Okay, so I'm going to open the rooms. You'll be automatically assigned. So Paul, anybody who doesn't get us, like Paul and myself, we'll all be invited, but we'll just stay in the room. We won't go in. But you go, you open yourself. So if we land in a room, we'll come out. So everybody, as you're all coming back in, I'm so sorry about that talk about Zoom. I think that was Zoom in practice. Note to self, don't run a workshop with 150 people in it, not possible. So what we've done is, at least you might have met some people, and I can see some of the challenges are already coming into the chat. So can you just paste into the chat some of what you think are these challenges? So we're not going to report back, we can't with 25 rooms, it's not, or 30 rooms, not possible. So just put these in the chat and let's have a look at these as we go. So.
Okay, I'm putting now my team's work.
Yes, just put it in the chat, Moy. That's absolutely fine.
Yeah, I did now.
I've seen it. Yeah, that's good. Okay, so let's have a look. So let's go start. I'll just go through assessment of individual members. So some sort of what the challenge of how to assess those. What do you do if some people aren't pulling their weight? Some people aren't very good team members. Yes, it's very subjective. So we'll talk about in a minute, how do we make the subjective objective? And really what we do is assess people in multiple occasions, multiple contexts by multiple people. So we're looking at lots and lots of assessment points, lots of data points, which is the core of programmatic assessment. So programmatic assessment is really good for assessing professional behaviours, particularly because we're wanting to look for development as people mature. Choose the suitable members if you can. We usually end up in the team that we're stuck with, don't we? Transparency and communication. So what is that challenge? Do people not say things? Do people keep hidden? Yep, thinking about the number of individuals. How do you make harmony, communication, lack of task clarity, delegation? Absolutely, all those core elements of teamwork. How do you do that? How do you assess if somebody's a good delegator? Or is somebody just palming off their work on other people? How do we assess this? What is it exactly? What is it we're actually assessing here? So lack of clear criteria. So that goes back to what are our learning outcomes? What are our competencies? What are our criteria for assessment? So, I mean, we worked quite hard, didn't we, Paul, on identifying our criteria for our workplace assessments based around professional behaviours, didn't we? You know, shows respect for team members. And what we did, and I think it worked really well, is we had four levels. The baseline level was satisfactory for stage of training, so what you'd expect for people. Unsatisfactory, and there was a sort of borderline, unsatisfactory but improved, and then there was an unsatisfactory but didn't, and then there was exceeded expectation for training. So you've got exceeded, satisfactory, you expect everybody to get there, unsatisfactory but improved with some guidance, and not satisfactory. And the not satisfactory raised concerns for us, didn't it? It was also every student who was unsatisfactory had a conversation with somebody, and if they kept getting those, then we kept having that conversation. Communication skills, so important. Peer evaluation, multi-source feedback, understanding and appreciating that people are different, and that's such at the root, isn't it? Assessors need to be present, absolutely, and that's a real difficulty in some really busy clinical departments where people are turning. How do people work enough with the students or with the learners to assess them? Okay, respect, demographic, abilities. Yeah, lots of trained assessors. We need that. Strategy, leadership, making the goals clear. Absolutely, yes. There's some definite consistency here about this. And so this clarity is really interesting. How do we get clarity about what it is we expect from our learners and what it is then we can assess, and we can assess fairly? Okay, so brilliant, loads of things on this. So on the recording, you'll be able to look at it afterwards and see the chat. So shall we go a little bit further, Paul?
Yes.
Let us go a little bit further. and talk about, do you want me to do it?
I've got it.
All right. Go on then.
When we think about assessment and fitness to practice, we can look at it from two aspects. Obviously, the academic aspect, fitness for what we call purpose. So formal assessments linked to curriculum learning outcomes, thinking about written guidance, so the understanding of professionalism, looking at law and ethics. Remember, going back to that slide where we talked about formal parts of the curriculum and communication. We could do that in practical situations, in OSCEs and some sort of skills tests, and obviously in clinical placements. So having some sort of supervisor give a placement evaluation at the end, but also using all members of the team in terms of multi-source feedback. And then the other side of the coin is that aspect of professional fitness to practice. So thinking about university disciplinary, whether you have plagiarism from an academic aspect, how you cope with lateness, how you monitor attendance, looking at general poor behaviors. So it's small poor behaviors being picked up as you go through, and you need some way of monitoring that, some sort of concern form so you can pick them up, but also how you monitor attendance. And then the regulatory bodies or the councils have all of the above. So they use fitness for rehearsal and fitness to practice, but they also have that element of health for practice, because at the heart of it is that element of patient safety. And when we think about assessments, we know that formative assessments or assessments for learning are very much developmental. They don't generally contribute towards an overall formal grade, and they're often used in the early stages of a course, but you should really use them throughout to give opportunities for formal feedback on the performance. And that's slightly different to thinking about summative assessments. Summative assessments are summative assessment of learning. So they determine how well a learner has performed at a particular point in a course. So you assess them at a particular time. They're formal assessments, and you tend to find for summative assessments, the results of that go towards the final grade or degree result. And these are the ones that tend to drive student learning, because they are hoops to jump through, and therefore they do learn for them. But they should also include feedback, and I think that can be one of the problems of summative assessments. Is we tend to think that they give an exam, they pass or fail, and that's it, but you need to make sure you have feedback as well. And for written assessments, in terms of looking at knowledge, whether it can be done in the form of case studies, whether it can be done in the form of critical incidents, whether it can be done in the form of situational judgment tests. You can think about how you can assess in terms of looking at service improvement and projects, or you could just have some sort of short answer questions. And that is what you're doing, is you're establishing the knowledge of the underlying legislative and administrative process, as well as ethical principles. And what we've tended to think is putting all those together now in a portfolio, so gathering all the evidence together and recording professional assessment over a period of time. As I said at the beginning, can't just have them all in one bunch. You need to make sure that they are separated out throughout your programs. In terms of practical or summative or formative assessments, so they tend to be competency-based. You can look at both technical and non-technical skills. They can be in the form of OSCEs, where you can use actors or you can use expert patients. All are aware that you can use them very well in simulations. You can have some sort of all assessments, or you could actually thinking about assessing a team or group, having group and teamwork tasks. And they can range from quite simple to fairly complex meta skills. So you needn't just thinking about the easy, that you can think about making it slightly harder. And then we move into what we need to think about is the workplace assessment. So it's the best place to assess competence in practice. It's that element of situated learning through and in the workplace. And assessment for that is absolutely vital. So it needs to be directly tied into work-based practice. And think about development of communities of practice and thinking about role models, but also having elements of thinking about using other seniors, using other health workers, using peers and near peers. So they needn't just come from the supervisor, they come from their colleagues, because the feedback from your colleagues is as important as the feedback that you get from your supervisor. And we're now starting to bring a lot more patients in. So are we getting feedback from patients about how students perform either in OSCEs or how they perform in the actual clinical workplace? I think very topical at the moment in terms of entrustable professional activities. So thinking about when a student is able to do something that you can entrust them to do that skill. So a particular third year nursing student might be able to be trusted to manage a ward round because they have the understanding, the competence, and they've got the behaviors. But another student in a similar thing, in a similar year and a similar degree might not be ready until they develop. So you can almost sign people off as entrustable professional activities, knowing that they're competent and they can be trusted to do a certain skill. So how do we do workplace-based assessment? There are lots of different ways. We can think of multi-source feedback, as we've said, from peers and from supervisors. The idea of mini-CAC, so observing them in the clinical workplace, in a clinical interaction. You can directly observe them when you want to think about practical or procedural skills, or what we call DOTS. You can do a case presentation, either through a video or peer review, but you can also do that apprenticeship model and supervision of working alongside and feeding back as you're working with them. And then thinking about simulation, you can always think about part-task trainers, that element of hybrid simulation. And nowadays, the simulation models are so realistic, they even have feedback, so that haptic feedback, so you can actually feel how, when you're trying to put an event plan in, when you're trying to take blood, you can actually feel pressure, and that's feedback for the student themselves. So thinking about the key points we've talked about so far. Professionals will be assessed in various ways. We've already talked about using assessment from a written, from a practical, and an observation of behaviours. But there are disadvantages and advantages to all methods of assessing professionalism. That we need to use multiple assessment tools over time in a different range of contexts, because what you're trying to build up is a whole picture of the person who has been assessed, not just a snap. You don't want a snapshot and say, oh yeah, we've assessed you for half an hour, you're professional. It needs to be done over a period of time. And therefore reflection and feedback needed to be embedded into the assessments so that students can develop that insight and self-efficacy. So let's now start thinking about going on to talking about leadership. So the definitions of leadership, John F. Kennedy, one person can make a difference and every person should try. Yukel talked about the process of influencing others to understand and agree about what needs to be done and how to do it, and the process of facilitating individual and collective efforts to accomplish shared objectives. So that idea of taking a lead in different situations. And in terms of thinking about the leadership triad, we all know that element of leadership, which can provide vision, that energy, those plan, and having that moral compass. And we always talk about the dark side of health professional in terms of management, but that's what provides our stability and order, and it translates the vision from our leadership into action. But as I said at the beginning, we don't lead all the time. Sometimes we step up to take a lead, but therefore it's very important to know when to follow. And followership can provide that support and challenge the leader, because without followers, then leaders can't operate. And therefore there are elements that cover all these aspects, that you need good management skills, you need good leadership behaviors, but you need to know when to follow, when to step up and take a lead, when to be able to incorporate management skills in your everyday work. You're muted.
Oh, I am muted. Sorry, I was so busy. I put myself and I think Dr. Waleed we put loads of, Dr. Yasser, Dr. Waleed, loads of different articles in the chat there for you. Can I just share my screen, Paul?
Yeah.
Okay, so back to our Mentee again. So same Mentee as before, same QR code, same link. So if hopefully you stayed on it. This question then is about leadership. What we want you to just think about, and you can just put some words or very short phrases in the Mentee here. We're not going to do another word cloud. What is it that we might want to assess? We've mentioned leadership, management and followership, but what specifically is it that we're going to measure? What is it that we're going to assess about leadership? Okay, and remember, all we can assess is what we hear or what we see. We can't assess what people are thinking because we don't know, and we have to be very careful about making assumptions. But how can we do that? Okay, so I'll just stop sharing there. So let's have a look at the Mentee. Excellent. People are starting. I've got one person to, excellent. Flick onto the Mentee. We should get a really good word cloud with so many people. Should be really good. And while you're doing this, I've just put a couple of things. Paul, can you put anything from the chat in into the onto the Mentee, would you mind?
Yeah.
I've just put a couple of things in the chat which are about leadership development. I put an article that we wrote in Medical Teacher, and then I've put the indicative curriculum for medical schools that we developed in the UK. So you can have just click on those links, and these are, they're open access. So you can have a look. Gives you loads of ideas about what you can do in your undergraduate curriculum in terms of leadership development. So let's have a look. What have we got? Professionalism, communication, lots of communication here. Decision making, team performance, cultural sensitivity, interpersonal communication, learning as a group. Okay, qualities of leadership. I would say these are all really good, but I would be looking at the level below. What do we mean by demonstrating self-awareness? What behavior are we looking for? Okay, because self-awareness itself is what we want, isn't it? That's what we're trying to develop. But how do we know when somebody demonstrates self-awareness? What is it we're actually assessing there? So this is the difficulty for us. This is the big challenge, is when we go to that next level, what is it we're looking for? What is it that would enable us to know that somebody facilitated cultural sensitivity, for example? So has anybody got any ideas about this next level down? What is it we're going to think about? Let's have a look at the chat. So there's lots of things in the chat, but again, it's what do we do? So what do we do about this level below? How do we measure honesty? Is it a lack of dishonesty? Okay, so quite a lot of these things that we talk about, we're almost measuring that people don't do it. Okay, so we're measuring the fact that they don't do bad behaviours. But what we're trying to do is think about, well, what behaviours do we reward? A bit like a dog, training a dog, isn't it? What do we reward? And what do we, that mean that people have passed an assessment? Okay, so what do people think about that? So, so Dr. Wapper's put solving problems, a measure of reaching objectives and performance. Yes, it could be achieving something, couldn't it? Or the amount of responsibility that they took for something. So you could reward something like leading a ward round, that they maintained time, that they were respectful of others, including the patient and the family, that they listened to ideas, that they had a handle on the management, that they put their knowledge into practice, that they listened to others about their views. Okay, so you could think that you could have these sort of situations that you might then say, okay, in a given situation, what do we expect of people? Okay, And a lot of that is about managing effective groups and effective communication flow. All right. So let's just stop sharing that now and let's go a little bit further. So, Paul, did you want to pick that back up then?
Do you want to pick up the reflective practice?
Yes, I can. I can indeed. So one of the big elements that we need to think about then is this concept of developing reflective practitioners. Okay. Is that right on screen, Paul?
Yes.
Yeah. Okay. So what are we trying to do? We're trying to get people to reflect in different ways. Donald Schoen talks about professionals being able to reflect in different ways, reflect in action, reflect in the moment. So as a supervisor or as an educator, we can ask questions of our trainees or our learners that enable them to reflect. What do you think is going through the patient's mind? You come away from the patient, they've broken some bad news. What do you think is going on in the patient's mind now? Oh, he might be frightened, he might be nervous, how he might be, you know, worried he's going to die tomorrow, whatever those thoughts are. Okay, so what could we put in place about that? And they might say, it'd be really good if some members of the team talk to him that he's got close to, like one of the nurses or something. So you're getting people to think about their practice, think holistically, and think about actually working with other members of the team. Reflection on action. So we can use structured written reflections. I'll give you some examples in a minute. Case-based discussions about scenarios or situations, or group discussions. Okay, we've just had the multidisciplinary team meeting. Now, my group of doctors, what do we think that was all about? Could we have, did we listen to everybody? Do you think we've made the right decision for the patient? So you can have these conversations around leadership. And then, of course, we help people to reflect for action. So what have you learned about yourself? What have you learned about the way you lead and the impact on others? What have you learned when you dismissed that person's idea about the care of the patient and they look very crestfallen? What did you do there? What could you have done better? What will you do differently? Okay, so we're developing that. So in a sort of more curriculum base, we can do all sorts of things. We can talk around reflection, we can talk about storytelling, we can help people to reframe situations and to actually look at things from other people's perspective. We do it about the patient a lot, but we can do it now about other members of the team. Okay, and you can give feedback. So we could have action learning sets, we can have guided reflection, group exercises. We do quite a lot of, do quite a lot of role modeling, creative thinking, self-insight. We use emotional intelligence, developing those ideas about what is emotional intelligence, what do we expect from you, and then how we're going to assess it. We use reflexive models. So we teach people and give people tools and lenses for viewing the world. And we talk about different tools and techniques like quality assurance, like the PDSA cycle. Okay, so you give people these tools so that then they can actually apply those tools in practice and then have that reflection. And the reflection bit is the bit we often miss. So we do quite a lot with our medical students around reflecting on their practice, and they get feedback from their teachers. So the Johari window is a really good idea about people learning more about themselves. So we've got this open quadrant here where we know things about ourselves and it's known to others. So you can see I've got blonde hair. So you know I'm a woman with blonde hair. I wear glasses. Okay, open. Actually, there are things that I might ask you about myself that are not known to increase this blindness. So at the beginning, I said, can you hear me clearly? Because I can't hear what you can hear. So I need to be sure that you can hear me. So that was me asking so that I would know, okay? Then there are things that you don't know about me, like you don't know that I've got 3 massive deerhounds and wolfhounds, but you do know now because I've told you. So that was hidden, so you didn't know that. And then of course this area is the unknown, where we don't know it about ourselves and other people don't know it either. I think we're into therapy territory there, so we'll back off. But asking and telling is how we build these reflective conversations. So we can also do reflective writing, and people shy away from summative assessment of reflective writing, but we use it a lot in education, and we use it in the medical program as well, the undergraduate program at Swansea. We teach people how to write reflectively and get feedback on that. And then for our master's program, we had a portfolio of 3,000 to 4,000 words with a reflective commentary. We teach people how to do significant event analyses, so take an event and analyse that regularly. We reflect on how groups work, how teams work, and we use models there. And then, of course, we take it to the next level and we do our reflection for action as well. You've got to be careful when you're using written reflections, because if you just have an open thing, then that's really difficult for people to oh, hang on, somebody's knocking on my door. Can you just finish this, Paul, while I just get the door? Just finish that and I'm coming back. I will be 1 second. You're muted.
What we need to think about is having a more structured, based on perhaps a series of trigger questions to answer, thinking about issues and challenges, thinking about role models, and thinking about having some sort of references to support what you said, and then supported by embedded activities around reflection throughout the course. And as I said before, when you think about professionalism, it's no good just doing it all at one point. You need to make sure that this reflection is throughout the whole of the program. So you can see the development not only of the individual, but you can also see the development of the individual as a professional. So you can see their developing role throughout the whole of the program.
So again, we want to think about how do we enable that team working, as Paul said. We've got to think about facilitating the development of working with colleagues. We have to provide health, safe, high quality, accessible, person-centered healthcare, and no professions can do that alone. And when we teach, this is why interprofessional learning is so important, because if we teach people in silos and they learn in silos and then they go out into practice, they don't learn how to actually work with other teams. So collaboration and teamwork, and build that into your course right from the get-go, because it's so important. But we need to think about some of the things we need to prepare our students and our learners for are around boundaries. Where are the boundaries? Who should be taking the care here? So we have some very formal things around handover, perhaps handover of a patient from the paramedics to the emergency department. That's very clear about what you do, who you do it to. We have handover in terms of night shifts, day shifts, one person to another. So thinking about that, teaching students about patient safety, what it is, what they can do about it, what's their responsibility, who's accountable, what are those things. Really give them really good examples of what happens when you don't attend to things like the surgical checklist, patient safety checklist. As you've all identified, good communication skills are key. And then, think about when teams go wrong. How do you enable your students to work in multiple teams? What is it they need to do? How should they behave? They need to listen and they need to respect. And how do you assess that and how do you teach that? So if we have interprofessional learning or education, it can help learners work more efficiently. But actually what you need to teach them is not just, say they're talking about caring for a dying patient or whatever the topic is. It's not just the topic. It's actually, how do people work? How is care coordinated, managed, passed on from one person to another? Where does the patient fit in that journey of who cares for whom? Okay, so this is really important. And so the support that we need for learners are around really thinking about, let's look what we do. Let's give students opportunities. Let's get them thinking about it. Let's have interprofessional clinical placements if we can. So in New Zealand, we had a really good example of our professionals going off together to work. We had pharmacists, public health, undergraduates, nurses and medical students, and they went in multi-professional teams to work in a rural location together. So this is really useful. And then let people see the tasks of teams. How do people deal with complex tasks? How do we actually get continuity of location and supervision? So you see things like longitudinal integrated clerkships are very good for that, because people work with teams, they're more stable. They can start to actually think about the team working and collaboration as well as what they're doing clinically. And this is what we're trying to do. So we were going to do an activity, weren't we, Paul? We were going to get you to design an assessment, but we didn't know that we'd have 140 participants in our workshop. We thought there would be about 30. So it has turned a little bit. But one of the things that you might reflect on, and we haven't got time to do the whole activity, but you know, how do we, if we define learning outcomes like this, to demonstrate understanding of the factors that promote and inhibit effective team working? Yeah, so that's a learning outcome in our programme, for example. And in fact, these two learning outcomes have been modified from what our General Medical Council requires of doctors at all stages, medical students and doctors in training and qualified practitioners. So if they're going to demonstrate understanding, we have to teach them that first. So we have to talk about team working. How do groups function? How do group functions well? What goes wrong? What do you do to alleviate it? Okay, so you can see the learning outcomes lead us down the track to an assessment. To be able to take a lead and follow appropriately in interprofessional teams, that's lifted directly from the professional capabilities of doctors from our General Medical Council. So we need to teach them about leadership. We need to teach them what leadership and followership is. We need to teach them what interprofessional, what that means and how people work and what the roles of different professionals are. And we need to teach them and observe them in taking a lead and followership, so they get feedback, but also we assess those skills. So really important that when we have teams working, that we talk about the goals of the team and the performance, and that's part of the discussion, not just what we're doing, but back to what I said at the beginning, how we're doing it. Okay, so the how we're doing it is really important, and then the individual learner can see how they fit in. So I'll just do this summary slide and then we'll just have a quick look at the chat and see if there are any questions. So much debate about what comprises professionalism and professional behaviours, but it's becoming much clearer. We've put a lot of things in the chat for you, lots of journal articles and web links. It's becoming much clearer, and all the councils now, the medical and the health professional councils, are defining that. Fundamental are teamwork and leadership, and they need to be assessed appropriately. So they need to be identified as important, then they need to be taught, learnt, and then we can assess them. So it has to be grounded in the real world. So taking leadership of a clinical situation, for example, an acute situation, you might be in the emergency room. How do you manage that emergency room? Okay, how is it managed? How do you take situational awareness? So those sort of things can be very often built into assessment of emergency room clinicians, for example. But people need feedback and they need opportunities to respond, and they need things reviewing, don't they? And I think Paul said this right at the beginning as well. Really assess, teach them, but also assess right from the beginning. So don't leave it till the last minute. Don't leave it till postgrad. And don't leave it to when people are qualified. Let's put these things in place early. Let's reinforce, let's get people used to using the language of leadership, followership, team working, interprofessionalism. So they're used to that. So it becomes a normal thing. And then we will be developing health professionals who are, you know, fit and competent, safe and compassionate to practice. And that's what we all want at the end of the day. So I will stop sharing a moment. I will have a look at the chat a little bit.
The Heck Matters asking about, could we follow the reflective writing process with large numbers of students? And yes, it is possible, but it is very important to think about, if you ask students to do something, if you ask them to reflect, you do need to give them feedback. So one, they can develop their reflective skills, and two, that they can learn from what they're doing. And I know from personal experience, we have projects in the medical school where I'm program director, and I was looking through the number of markers we have for each of the projects, and I have more people marking reflections than any other thing in the whole program, because our students reflect after every clinical placement, and therefore you need to give feedback, and therefore you need so you need to make sure you've got the resources in place. If you ask the students to do something, and I think doing reflection is an important aspect, you need to make sure that you have people on hand that can give some feedback. It might be that you can read all the reflections and then give generic feedback to the whole cohort. But then there are some where you read them, and sometimes by reading reflections, you can pick up on students who are struggling. You might pick up on students who need additional help in areas, and therefore it's important to be receptive to those. No good just using it as a paper exercise. You've got to make sure that we use it as part of that assessment.
I'm just looking for something on reflective writing for you. Right, let's just pop here. I'll put this up. Right, here's something that we've used a little bit. It's from a woman called Jenny Moon. There you go. So, asking about the effect of rolling out the leadership positions. I think we're getting into whole new territory there, aren't we? You know, thinking about that. But one of the things I think is really important is that you bust some of the myths of leadership for people. You know, leadership isn't all about being in a position. Leadership is about a set of activities and a set of behaviors. Okay, so you can lead, we call it little L leadership in a really small way, or you can be the top CEO of a massive Fortune 500 company. You're still doing leadership stuff. Okay, so leadership and followership, you know, apply at all levels.
And Neil is asking, what are the tools or methods you use to assess reflections? You know, what the criteria meets expectations. It's important to give it to the student. When you need to explain to the students what reflection is, and give them the necessary tools. So introduce them to a couple of reflective tools and encourage them to use it. Because if you use a reflective tool, it naturally leads you into reflection itself. And I think what you need to do is do it as a pilot, formatively first, and get some feedback. And the way in which you can decide on your criteria for meets expectations or pass is it reflection? Well, you need to decide on what you define reflection to be, but also makes it easier if you do it as a pilot to be able to put examples up then, so you can give some examples and you can anonymize them and say to students, this is what we're looking for. We can also give them examples of what is not reflection. So somebody wrote a purely descriptive report and it had no reflection, it was just a description of what happened. You could say, very good, this is a very good descriptive element, but it hasn't reflected on your practice. Remember, the whole point of reflection is thinking about what's happened. What would I do differently next time? How did it make me feel? Is it changing my behavior in terms of if I reacted if I encountered the same situation again?
I've just put a couple of things in the chat there. So I put you something from Jenny Moon about reflective writing. I've put Gibbs' reflective cycle in there, which is quite a nice one about your career development. And then I've just put what I call the simple basic reflection. What happened? So what have I learned? What do other people say about it? Now what? What am I going to change? How am I going to take that forward? So what, now what? I think it's Chris Johns's model is just so simple to get people to reflect. I mean, I think getting people to reflect out loud and you prompting by, okay, tell me what happened. Okay, so what did other people say? Oh, what did you learn? Yep. Okay, so you've learned this about yourself. You know, you were rude to the consultant and you felt humiliated. So what are you going to do about it? Okay, so how are you going to change? Okay, and some people might say, oh, well, they need to change their attitude. No, you need to change. Okay, so it's really that self-development is at the core of all this. We could go on for 4 hours, couldn't we, Paul? Yeah. And I'm very aware it is actually the finished time. I'm going to hand oh, I see a friend there. You changed your name.
Yeah, I really want to a quick interruption, and then I will leave you with this wonderful discussion with the participants. But I want to express my sincere thanks to you, Judy and Paul, for accepting our invitation and to join us today and tomorrow really, this is something very great, and I can see the huge number of participants in the workshops of today. I think close to 1,000 in the different workshops today, and I don't know how many with you. 160. I think perhaps this is a really big workshop.
It's not a workshop.
But and there are 3,000 participants in this conference so far from 37 countries. So
excellent.
People will be listening to you from China to the States to everywhere in the world. And so again, many, many thanks. And I look forward very soon that we'll get together. I'm very sorry that it didn't work around November, December. It was still a peak. Of course, the situation now is much better. And I'm judging about the situation in UK by watching the Premier League and seeing the Liverpool Stadium full. So I think this is one of the important indicators that things are better. So once more, many thanks, and I'm sure all the participants will have the same feelings. And we will all going to reflect on what you have said. Thank you very much. Thank you.
Thank you. Thank you so much. It's been a pleasure to be invited and a pleasure to sit in my forest. So you have the recording of this and they'll be made available. I think we took a massive topic. I think we were given a massive topic, you know, all sorts of things, teamwork and interprofessional leadership, you know, that each of those could be, you know, 4 months in itself. But we touched base, we've had some ideas, we've shared a bit of practice. And I just like to thank you all for bearing with us, and trying to do an interactive workshop with 130 people is a bit challenging, isn't it, really? But hey ho, I hope you've got something out of it, and I hope you've enjoyed it. And we've very much enjoyed meeting you, however briefly.
Thank you very much indeed. We look forward to seeing you face to face in the future, inshallah.
Oh, inshallah, absolutely.
So much. Thank you, Prof. Judy. Thank you, Prof. Paul. Thank you so much for this very interactive and insightful session. Thank you so much. Thank you.
Thank you. Okay, see you tomorrow, everybody. I will be talking more about leadership, but in a slightly different way.
You guys soon.
Thank you.
Thank you.
Okay, Paul.
Thank you. See you later.